Are you unsure if you're avoiding your anxiety? Or maybe you can't tell if you're doing safety behaviors, ritualization, or compulsion. Sometimes it's hard to know. Here's one little guideline that might help you sort that out. Oh, and please stop asking ChatGPT if you're compulsing. It doesn't know. When we are dealing with anxiety disorders and OCD, we're taught all the time that compulsions, rituals, avoidance, and safety behaviors are bad. Sometimes we can't tell if we're doing them or if we're taking reasonable action or action driven by our values. One big tip-off when it comes to avoidance or compulsions or safety behaviors is that in the moment, those things will feel correct. But when the moment has passed, you will have wished that you didn't do that. Compare this to values-driven action or action that's adaptive or helps you in the long run. You will rarely question what you did there. So one thing you can look for is a vacillating belief. If you are doing things that you feel like you have to do in the moment, but then wish you could stop doing, those are probably compulsions, avoidances, or safety behaviors. If you are taking action that you really don't question after the fact, then you're probably acting in accordance with your values. But as always, you may get this wrong and you may not be perfectly sure. That is fine. There is no such thing as perfect recovery or perfect desensitization. You're just going to have to learn through experiences. Remember, in this thing we're doing, we are either winning or learning. So do one of those two. You really can't get it wrong if you take that approach.